This device is used to maintain patency of malignant esophageal strictures and/or to seal traqueoesophageal fistulas. Do not use this device for any purpose other than the stated intended use. If the package is opened or damaged when received, do not use. Visually inspect with particular attention to kinks, bends, and breaks. If an abnormality is detected that would prohibit proper working condition, do not use. Please notify cook for return authorization. Store in a dry location away from temperature extremes. Use of this device restricted to a trained healthcare professional. Contraindications include those specific to upper GI endoscopy and any procedure to be performed in conjunction with stent placement. Additional contraindications include, but are not limited to, total esophageal obstruction, strictures that cannot be dilated to 10 millimeters, placement requiring position of the stent within 2 centimeters of the cricopharynx, surgical resection candidates, hiatal hernia, and gastric prolapse in the esophageal area, patients with a perforated esophagus, placement in actively bleeding tumors, benign diseases. Relative contraindications include, but are not limited to, uncooperative patient, coagulopathy, tracheal compression, recent myocardial infarction, cervical arthritis with fixed cervical spine, large tumor mass occupying the mediastinum, non-obstructive tumor, gastric outlet obstruction, necrotic esophageal mucosa, acutely angled stenosis. Potential complications include those associated with upper GI endoscopy, including but not limited to perforation, hemorrhage, aspiration, reflux, fever, infection, allergic reaction to medication, hypotension, respiratory depression or arrest, cardiac arrhythmia or arrest. Additional complications include, but are not limited to, stent misplacement and/or migration, tumor ingrowth or overgrowth, esophageal ulceration and erosion, nausea, chest or retrosternal pain, foreign body sensation, food bolus impaction, gas bloat, sensitivity to metal components, fistula involving trachea, bronchi or pleural space, intestinal obstruction secondary to migration, mediastinitis or peritonitis, airway compression, tracheal obstruction. Precautions. A complete diagnostic evaluation must be performed prior to use to determine proper stent size. Stent should be placed using fluoroscopic monitoring. The stent should only be placed with a Cook delivery system, which is provided with each stent. Prior to advancing the system, the area to be stented should be dilated to a minimum of 10 millimeters and a maximum of 14 millimeters. If the area is dilated greater than 14 millimeters, the stent may migrate. This device is intended for palliative treatment only. Alternative methods of therapy should be investigated prior to placement. After stent placement, alternative methods of treatment, such as chemotherapy and radiation, should not be administered, as this may increase the risk of stent migration due to tumor shrinkage, stent erosion, and/or mucosal bleeding. Long-term patency of this device has not been established. Periodic evaluation is advised. After stent placement, patients should be instructed to chew food well or eat soft or pureed food. Warnings. MRI compatibility of the Evolution esophageal stent has not been established. The stent is not intended to be removed and is considered a permanent implant. Attempts to remove the stent after placement may cause damage to the esophageal mucosa. Stent cannot be retrieved after the deployment threshold has been passed. Corresponding marks on the outer catheter and delivery handle indicate when the threshold has been passed.